Hello, this is Dr. Gay from First Leg MRI, and this is a 16-year-old male with a recent foot injury, and we see something between the second metatarsal base and the medial cuneiform bone and the first cuneiform bone. Right here, this space, we have intermediate signal on the T1 sequence here. There's a gray signal, and there's a little linear band here. So this is where the Lisfranc ligament attaches. A super important ligament. So this is a little avulsion fragment. It may arise from the scalloped area here, the base of the second metatarsal bone there. You can see the area, the donor site there. There's a little cortical avulsion that's uplifted, and the Lisfranc ligament, instead of seeing a nice linear black obliquely oriented band like we should see, we see this gray tissue. So this is a tear of the Lisfranc ligament and an associated avulsion injury. Some of the ligament fibers may still be intact, and they're probably attached to that little avulsion fragment there, that linear band. I really can't see them, and so when we see this, we have to mention number one, the Lisfranc ligament. It looks like it's torn, and there's an associated bone avulsion fragment here. And then the other critical thing is there a dislocation? So when this tears, the second, third, and fourth metatarsal bases can shift laterally. So look for the association here. It looks like these are well aligned. There's no evidence of midfoot subluxation or dislocation. So it looks like this is just a tear of the Lisfranc ligament with an avulsion injury, and then no associated dislocation at this time, which is great. So now this is a stir sequence here. You can see the prominent marodema here. That little avulsion injury is not as well seen. A little bit of marodema in the medial cuneiform bone here as well. Again, no dislocation. Here's the short axis T2 fat set sequence, and right here is the fracture. Here's the base of the second metatarsal, but really hard to see. If you follow the medial border, it comes down, pokes out, comes back. So this is a little fragment. So we did an x-ray to confirm, and here we go. This little curvilinear thing is the fracture fragment right there, and again, this is where the Lisfranc ligament goes across, and that's it. Thank you very much.